Welcome to this presentation on the medical aspects of addiction and co-occurring disorders, brought to you by allceus.com. In this course, you will learn to identify medical aspects of addiction and co-occurring disorders to include neurochemical imbalances, hepatitis, tuberculosis, and HIV. You will discuss the physiological problems and negative side effects caused by different substances of abuse, and you will be able to discuss methods of pain management for persons with addictive and co-occurring disorders. First, let's take a look at neurochemicals and mental health. Schizophrenia is thought to be caused by an impairment of dopamine containing neurons in the brain. Medications that block dopamine receptors in the brain, such as clozapine, are useful in treating schizophrenia. Depression is treated with the drugs that affect norepinephrine and serotonin. SSRIs, your most common antidepressants, sort of the first line out there right now, inhibit the reuptake of serotonin, increasing neurotransmitter action and availability. So it's kind of like if you spill water on a table and you immediately sop it up, it's not going to get absorbed and make the wood warp. But if you let the water set for a while before you pick it up with a sponge, then the fibers in the wood will swell and absorb some of that water, and the wood will become distorted. Same sort of thing with SSRIs. If we leave more serotonin, or if we leave the serotonin between the synapses for a longer period of time, then it has a greater effect than if it just goes and is reabsorbed really quick. So people who maybe don't make enough serotonin, instead of causing the body to make more serotonin, what we do is keep it from being absorbed as quickly. Increased serotonin activity is known to alleviate depressive symptoms. Alzheimer's disease seems to be caused by a loss of cells that secrete acetylcholine. Some medications to alleviate the symptoms have been developed, but there is no known treatment. One of the things we found over the years is that we can delay the progress of Alzheimer's, but they haven't found a way to completely stop it. Generalized anxiety disorder involves several neurotransmitter symptoms in the brain, including norepinephrine and serotonin. Generalized anxiety disorder, when somebody is, for lack of a better word, hyped up, high-strung, worried about everything, they don't have enough of their feel-good chemicals or their relaxation chemicals to balance out what is being secreted for the fight-or-flight response. An attention deficit hyperactivity disorder has been related to dopamine and norepinephrine imbalances, which are strongly implicated in causing ADHD. So dopamine and norepinephrine, again, are feel-good chemicals that are either lacking or they're getting reabsorbed too quickly. Drug-related neurochemical imbalances include serotonin. When people use drugs and that affect certain neural pathways, they will develop usually a depletion of serotonin. They sort of use it up faster than they can make it. This affects emotion and motivation. Drugs that affect GABA affect their inhibition. Dopamine is their pleasure and reward pathway. So when they use a lot of these really feel-good chemicals like ecstasy, the pleasure reward center is overstimulated. And norepinephrine. Norepinephrine is the opposite of epinephrine, and it's secreted to help people calm down. But if you don't have enough of it, or you use it up faster than you can make it, then it's going to be hard for you to calm down and not be anxious and, quote, stressed. Medical aspects and health problems associated with alcoholism and drug use include pancreatitis. Anytime you see an itis on the end of a word, you can pretty well guess that means inflammation of. So inflammation of the pancreas, gastritis, duodenal ulcers. We all know what ulcers are. cancer of the esophagus, alcoholic hepatitis, cirrhosis or hardening of the liver, varicose or swollen veins in the esophagus, delirium tremens or DTs, neuritis, impotence, and more. Let's look at pancreatitis. The pancreas is a small organ lying in the uppermost portion of the abdomen. It produces insulin and the digestive enzymes vital to life. Inflammation of the pancreas causes severe abdominal pain, nausea, and vomiting. Alcohol is poisonous to the pancreas, among other things. Gastritis. That looks pretty, doesn't it? Heavy drinking is the most common cause of serious inflammation of the lining of the stomach. The mucosa in the stomach becomes reddened with bleeding in areas covered with thick, ropey mucus. Symptoms include nausea, vomiting, headache, and stomach pains. Duodenal ulcers, or ulcers in the intestines. The duodenum is the first part of the small intestine. Ulcers develop here due to irritation from stuff coming out of the stomach. Bleeding, obstruction, and perforation may be fatal complications. So obstruction is obviously blocking, and perforation is actually severing or opening up the bowel. Esophageal cancer. An unknown chemical quality in alcoholic beverages causes alcoholics to have far greater chance of developing cancer of the esophagus. Cancer causes difficulty in swallowing and a sensation of blockage behind the sternum. Your sternum is your breastbone. Varicose veins in the esophagus. Cirrhosis of the liver produces a secondary increase in blood pressure in the veins of the esophagus, or the food tube that leads from the throat to the stomach. Death from internal hemorrhaging may occur if ballooned out veins rupture. One of the great risk factors for making these things rupture, among other factors, is vomiting. So an alcoholic who drinks so much that they vomit may inadvertently rupture these, and or an alcoholic who also happens to be bulimic may inadvertently rupture these. There are lots of other things that can cause them to rupture, including just simply increasing blood pressure enough where the veins just can't keep everything together. So it's very, very important to be aware that this is a life-threatening emergency. People can bleed out into their stomach. Delirium tremens. The DTs begin with tremors, sweating, nausea, and progress to insomnia, profound confusion, delusions, hallucinations, and convulsions. This serious complication may be fatal for about 10% of its victims. It's very important to monitor clients who are in detox as they detoxify from alcohol, because not only when somebody is sort of on their natural down from alcohol, but also when they're detoxing, they can be at higher risk for high blood pressure, stroke, and other complications. If they come in and they've already got the DTs, you know that they're in a really precarious physical position at that point. Neuritis. Prolonged intake of alcohol has a direct poisonous effect on the nerves in the arms and legs. Symptoms include tingling, the sensation of pins and needles, itching, numbness, weakness, and paralysis in the limbs. So if your clients start complaining that they're having tingling in their arms or legs, this could be heart attack, this could be stroke, this could be neuritis. Don't just send them back to bed or wherever you send them. Make sure that you have them evaluated by a physician to see what exactly is going on that's causing these symptoms. Impotence. Alcohol is one of the most common causes of impotency. In acute alcoholism, impotency may be caused by the depressant effect of the drug. In chronic alcoholism, impotency may be caused by neuritis, liver damage, malnutrition, or other complications. AIDS. IV drug users risk exposure to the AIDS virus when they use or share contaminated needles. IV drug users form the group with the fastest growing number of persons with AIDS. Liver issues. Alcohol-induced liver disease. The three main types of ALD are fatty liver, alcoholic hepatitis, and alcoholic cirrhosis. Fatty liver is the buildup of fat inside the liver cells, which leads to the enlargement of the liver and abdominal pain. Alcoholic hepatitis is severe liver inflammation where the liver cells are destroyed, causing scarring, tenderness, and enlargement. Alcoholic cirrhosis occurs when scar tissue develops, hampering the flow of blood to the liver. Most people, not all, most people who have alcohol-related liver issues have that characteristic beer belly. They have a bloated abdomen, and it's usually very tender at times. Hepatitis C. Hepatitis is an inflammation of the liver caused by a virus, alcohol, medications that have a harmful effect on the liver, toxins, or autoimmune disorders. So hepatitis is not just caused by alcohol. There are 7 known types of hepatitis: A, B, C, D, E, F, and G. Hepatitis C may be the leading cause of chronic liver disease in the Western world. Some of these hepatitis viruses have vaccinations, some of them don't. It's important to make sure that you are vaccinated against hepatitis B if you're working in the healthcare industry. Hepatitis is transmitted through IV drug use, needle stick injuries, body piercing or electrolysis, sharing personal care items like toothbrushes, nail clippers, files, razors, or other household items that have blood on them. Intranasal cocaine use through shared use of straws may lead to blood-to-blood contact through nasal ulcers or cuts and scrapes. And sexual activity that results in blood-to-blood contact. Now, when you think of it, you think, well, sharing personal care items like toothbrushes, that's not a needle. No, but people who are in poor health especially very often have bleeding gums, which will put blood on their toothbrush, which you can get into your mouth. And if you have bleeding gums because your gums are in bad shape, or because you just flossed, or because you ate a chip that nicked one of your part of your gum before you were able to swallow it, you can have that blood-to-blood contact. Cirrhosis. Cirrhosis is the 7th leading cause of death in America. Alcohol is the leading cause of cirrhosis. Symptoms include loss of weight, chronic nausea, vomiting, weakness, loss of sex drive, abdominal pains, bloating of the abdomen, and bleeding. Sometimes when cirrhosis gets bad enough, they'll actually have to drain the fluid from the abdomen to allow the person to be in a little more comfortable. Serum hepatitis. Hepatitis is one of the most common problems in heroin addicts. It's caused by a virus which is transmitted through contaminated needles. Hepatitis causes weakness, loss of appetite, tenderness in the abdomen, dark-colored urine, and a yellowish change in the color of the skin and whites of the eyes. This is what we often call jaundice. So if you notice that the whites of your patient's eyes are starting to get a little yellowy, or they're starting to get kind of an orange tint that's not due to using fake tanning products, you may want to have them evaluated by a physician for hepatitis. Alcoholic hepatitis. Symptoms include fever, jaundice, swelling in the abdomen, and swelling of the feet. In alcoholic hepatitis, the liver is large, firm, tender, and infiltrated with fat. Many patients die, and others go on to develop cirrhosis of the liver. Brain abscesses. When germs are injected into the bloodstream from an unsterile needle, they may travel through the body and lodge in the brain. In this illustration, note the ragged, abscessed cavity filled with pus. High fever, convulsions, coma, and death are signs of a brain abscess. Wet brain. Wernicke-Korsakoff syndrome is one type of wet brain. It's caused by long-term alcoholism. It has a triad of symptoms including mental disturbance, confusion, drowsiness, and paralysis of eye movements, ataxia, or a staggering gait. Due to a B1 deficiency, usually caused by malnutrition and poor intestinal absorption of food and vitamins, caused by alcohol. So wet brain is due to a nutritional deficit that is exacerbated by alcohol. You start irritating the lining of your intestines and your stomach, it can't absorb the nutrients it needs. No matter how healthy you're eating, it can't absorb and be as efficient. Drug smoking and lung infections. Tobacco, marijuana, or crack cocaine increases the user's risk of bacterial pneumonia, bronchitis, and asthma. Smoking anything appears to paralyze the cilia, which are hair-like projections in the lungs that sweep out microbes and other matter that may cause disease. Smoking cocaine appears to weaken the lungs' natural resistance to infection. Crack hack produces black or bloody phlegm. You can also inhale small bits of metal from the use of a screen or a Brillo pad for smoking drugs. Thermal burns to the nasal passages and the throat may go unnoticed due to the anesthetizing effects of cocaine and crack. Cocaine may burn holes through the septum, that's the thing that divides your nose, and burn away the mucous membranes in the nostrils, leading to staph infections in the nostrils, which can spread to the sinuses and possibly the brain. Bacterial endocarditis. We're talking about the heart here. Germs from an unclean needle may spread throughout the body and lodge in the valves of the heart, causing bacterial endocarditis. Remember, we talked about itis meaning inflammation. The warty-like growths seen on these heart valves produce symptoms of fever, weakness, heart failure, and death. Blood clots. When addicts' veins are repeatedly punctured, particularly by unsterile needles, blood clots and scarring may occur within the veins. So let's take a look at what methamphetamine may actually do to a person's appearance. 1 year and 5 months later, she looks like a completely different person. Methamphetamine disrupts sleeping patterns, suppresses appetite, and causes irritability and aggression. Suicide. Suicide is the 10th leading cause of death in America and the 3rd leading cause of death in people below the age of 30. Alcohol is a factor in more than 60% of all suicide attempts. Alcohol is a disinhibitor. When the initial calming effects of alcohol start to wear off, people get stressed and anxious. Oftentimes, this will cause sort of a paradox where the people feel like, I can't even win, I can never relax. With the disinhibition effects still engaged, they're more likely to do something they wouldn't do if they had that mental filter on that says, do I really want to do this? So alcohol is a factor that some people actually use if they're planning on attempting suicide because they feel it'll give them the courage. Alcohol is also a factor in people who weren't planning on attempting suicide, but it just kind of sounds good at the moment. Birth defects. Alcohol passes through the bloodstream of the mother and into the uterus and placenta and directly into the unborn child. Children of women who use drugs are born underweight, their brain size is less than normal, their hearts may not be completely developed, they may have a cleft palate, and they may continue to grow at a slow pace after birth and end up as smaller adults. This is not always the case, but it is a significant risk that every woman takes if she's drinking alcohol or using drugs during her pregnancy. Child abuse. Approximately 1 in every 100 American children is physically, sexually, or psychologically abused at least once. Excessive drinking by the abuser is a major factor in a large majority of these cases. When children are being children, if somebody is under the influence of alcohol, they may be more likely to lash out instead of being a good parent and trying to figure out how to redirect the child or correct the behavior. They may become abusive. They may take out their frustrations or their aggressions on a child. You know, the child does something that seems relatively benign, but all the stresses of the day suddenly come flooding forth, and the child bears the brunt of it. The inability of the parent to protect the child may also be a factor if the parent is incapacitated through the use of alcohol or other drugs to protect the child from someone else who's going to harm him or her. Murder. The 12th leading cause of death in America and the leading cause of death in people below the age of 30. Alcohol is implicated in more than 70% of all murders and other violent crimes. In summary, alcohol abuse and drug use is the #1 social problem we face today. It causes a variety of health and social problems. These problems have a financial impact for employers, healthcare, criminal justice, foster care, and individuals themselves. Many children who grow up in an addicted family become addicts themselves.